Assalamualaikum, it's Dr. Faraz Ahmed, and today I am here with a very good news for you people that now onward we will give you a task in group on weekly basis, and after evaluating your letters on individual basis, we will publish a video on that case note, that how to write a letter, a complete letter from that case note. So let's move to the video, and in this video we will discuss how to write a letter from case notes, and we will also discuss about the inclusion and exclusion criteria. Okay, let's move forward. So in the exam, this type of case notes will be given to you. Here you can see that some information about the writing letter are given at the start, and then you are given with case notes, and at the end of the case notes you are given with writing task. Okay, so you can see in the start of the your case note that you are given with time, that is 45 minutes to complete your letter, and out of these 45 minutes you have 5 minutes to read this case notes, and you have 40 minutes to write your letter from the case note. Keep in mind that some people think that they have only 5 minutes to read the case notes, and after these 5 minutes your case note will be collected back. So this is not true. You will have your case note to you for whole 45 minutes, and you can adjust these 5 minutes to read the case notes as you want. You can take up to 10 minutes, 5 minutes, 6 minutes, and you can take as much as you want. So guys, before start of writing your letter, read the case note comprehensively and very carefully, and underline the information you want to include in your letter, and then move to the writing your task. So guys, before starting our writing, we have to read carefully the case notes, and in case notes, first of all we have to read the writing task. First of all, move to the end of your case notes and read the task carefully. You have to underline 3 to 4 information. First information is a type of letter. You can see here that it is a type of referral letter or discharge letter. So you will be given these information here. So let's read the writing task. Using the information given in the case note, write a letter of referral. So it's a referral letter. Underline it to the thoracic surgeon Dr. Penny Clifton. So here we can see that it is a referral letter, and we are referring the patient to thoracic surgeon Dr. Penny Clifton. And here you will be given your purpose of letter, purpose of writing your referral letter. What is purpose? Seeking the follow-up investigation and assessment. Okay, so this is your purpose. Address the letter to Dr. Penny Clifton, Department of the Cardiothoracic Surgery, Central Hospital, Main Street, and the Stillwater. Okay, so every information, a type of letter, to whom you are writing your referral letter, and what is the purpose of your letter, and the address of your referring doctor will be given in the writing task. After reading your writing task, then we will move to the case notes, and please keep in mind that after reading your task, don't move to the start of your case note. Just move to the last 3 to 4 lines of your case notes, that here these are the last 3 to 4 lines where final assessment and final plan will be given. After writing task, we will read this final assessment and final plan. So let's see what is final assessment. So final assessment is bronchogenic carcinoma, and what is final plan? Consult on the potential diagnosis and the need for the further investigation. So this is the purpose of your writing letter as well, that consult the patient on potential diagnosis and need for the further investigations. And here a complete purpose of letter will be given. Refer to the thoracic surgeon for follow-up investigation, including bronchoscopy and biopsy and the assessment. So guys, first of all, read the writing task, and then read the final assessment and the plan given just above the writing task. So these definitely help you in writing your introductory paragraph. Okay guys, so before reading let's discuss about inclusion and exclusion criteria. So guys, keep in mind that read the case notes keeping in mind your diagnosis and the plan. So we have just finished with writing task and final assessment and plan, which we have discussed lastly. So keep that final diagnosis, final assessment and final plan in your mind, and then read the case notes. So once you have diagnosis and plan in your mind, it will definitely help you that which information you have to include in your letter and which information you have to exclude from the case notes. So guys, keeping in mind your diagnosis and your plan, we can underline or we can encircle the information which we have to include in our letter here. I will use arrow mark with the information that has to be included in our letter. You can use any mark, and I will use a tick mark for the information that could be included if the word count allows. There are information in letter which you can include or which you can exclude as well. If you can include that these information if your word count is allowing you, and there are information which you have definitely you have to exclude from the letter. We will not underline, we will not use an arrow mark, or we will not use a tick mark with the information which we have to exclude from the letter. Okay guys, let's read the case note applying the inclusion and exclusion criteria. So let's start from here. We can see that read the case note below and complete the writing task which follows. Okay, start. Mr. Mary Clark, born on the 17th September 1960, is a patient in your general practice. So patient name and patient date of birth is very important. We have to include on any price. So we will highlight or we will underline this, and we will use arrow with this. Okay. The address of the patient is not mentioned in your letter, so we will not use any mark like tick mark or the arrow mark. Social background. A 54-year-old office clerk, we will use an arrow mark and we will underline it. A married, lives at home with his husband and the 20-year-old son. We can include this information if our word count allow. Okay. Smokes 30 to 35 cigarettes per day for more than 30 years. So this is very important information related to bronchogenic carcinoma. So keep in mind, we are reading this case note keeping in mind our diagnosis, which is bronchogenic carcinoma, and our plan. What was our plan for assessment and for follow-up investigation, which were bronchoscopy and biopsy. So smoking is very important related to bronchogenic carcinoma. So we have underlined it as well, and we are using a tick arrow mark here. Okay. Family and medical history. Mother 66-year-old died of laryngeal carcinoma. This is very important, so we have used arrow mark. Father, a coal miner, 54-year-old, mind-related lung disease. This is again very important, and we have used arrow mark as well. Nil medication, no known allergies, patient present with a sore throat, body aches, fever, and the cough. So we are using tick mark here. If our word count allows, we will include this information in our letter. Okay. So first visit was patient presented with sore throat, body aches, and fever and cough. Okay. Prescription was Augmentin. And then patient again presented and on 27 August 15. 7-week history of the dry non-productive cough with no hemoptymesis. Cough commenced with flu-like symptoms, cleared with the Augmentin. So this history is very important. This is the presenting complaint, so we have to include this information on any price. So we are using an arrow mark here. So the cough is associated. So association of the presenting complaint, association of the main complaint, we will also include the association of this main complaint. So what is the association? Associated with mild shortness of breath, especially as the night, and the strained sensation of the heaviness in the chest. So this is very important, and we have underlined this information as well. There is no fever, night sweats are the rigors, and exercise tolerance test is okay. So we can include this information about the exercise tolerance test. So we can include or exclude as well. So we are using tick mark here. Examination findings: temperature is 37, temperature is normal, pulse is normal, regular, height is 165, weight is 68. So these information are normal, so we are going to exclude them. Okay. Then respiratory examination. So we are talking about bronchogenic carcinoma, which is respiratory system problem. So we will definitely write the respiratory examination, and we are going to underline this information, and we are using a arrow mark. Respiratory examination: signs of consolidation associated with monophonic wheeze in the right mid zone. So this information will be included in the letter. No cyanosis or the dyspnea, ascites, no hoarseness of the voice, Horner syndrome, no cervical lymphadenopathy. So guys, we are going to write a letter on diagnosis of bronchogenic carcinoma. So we can see that for carcinoma, lymphadenopathy, lymph node status is very important for any type of carcinoma. So for bronchogenic carcinoma, cervical lymph node status is very important. Although there is no cervical lymphadenopathy, but we can mention this information as well. Okay, so that's why I have used this tick mark here. No hepatomegaly, splenomegaly, the systemic review, GIT, CVS normal, and the sputum cytology is also normal. So for our diagnosis, which is bronchogenic carcinoma, we can include cervical lymph node status, and we can include the sputum cytology status in our letter as well. So chest X-ray and the CT scan were ordered, and which shows the right middle lobe, atelectasis, enlarged right hilum. So this information is very important. That's why I have underlined, I have marked this information as well. Let's move to the next page. So this is assessment. We have already read this assessment, bronchogenic carcinoma, and we have already read the plan, consult on the potential diagnosis and need for the further investigation, referring to thoracic surgeon for the follow-up investigation, bronchoscopy, biopsy, and the assessment. So we have done with our case notes, which is very easy, and we will discuss, we will write letter with the difficult or the lengthy case notes in future as well. So now, keeping in the information which we have underlined, which we have encircled, which we have used with the arrow mark, we will now start writing our letter. Okay guys, so we will start with our writing date, 22nd August 15, Dr. Penny Clifton, thoracic surgeon, Central Hospital, Main Road, Stillwater. So guys, let me tell you your mistake here, that some people use space between this address. Don't leave any space between the address. Write the address without any space, then leave a space and mention dear Dr. Clifton, then leave a space and mention reference Mrs. Mary Clark. You can use comma here, date of birth, and you can write your date of birth on the next line without comma as well. Okay guys, let's move. So here I will tell you how to write the introductory paragraph of this letter. So guys, our patient is Mrs. Clark, who is 50-year-old and who is office clerk. So guys, keep in mind an information here that try to include the profession of your patient in your introductory paragraph. You can also write the profession of your patient in second paragraph, in paragraph of social and the personal history, but it's look good if you include the profession after right after the name of the patient. So we can start like thank you for seeing, or you can start, I am writing to refer Mrs. Clark, a 50-year-old office clerk. So it's look good if you mention the profession here, whose clinical features, whose signs and symptoms are suggestive of or consistent with bronchogenic carcinoma. So guys, try to use templates while writing a letter. In this way you will commit minimum mistakes. Like in our secondary school, in our intermediates, we used to use these type of the templates while writing applications or letter. So try to use templates while writing a letter, so it will help you in scoring good marks. Okay, so let's read once more for you people. I am writing to refer Mrs. Clark, 50-year-old office clerk, whose clinical features are suggestive of bronchogenic carcinoma. So guys, keep in mind, most of the people are committing mistakes here, that they don't mention a clear purpose, purpose of your letter in the introductory paragraph. The purpose of your letter should be very, very clear in your introductory paragraph. So what is the purpose? Your further assessment and investigation would be greatly appreciated. I have told you that in final assessment and final plan paragraph, just above the writing task, these plans were given very clearly. In plan paragraph, your purpose will be given. So what was the plan? Further assessment and investigation, including bronchoscopy and biopsy. You can also write bronchoscopy and biopsy here as well. Okay, so in this way you can write a very good introductory paragraph of your referral letter. So after introductory paragraph, as we know, this is not an emergency letter. 2 or 3 students were also committing mistake here, that they were not mentioning the social, family, or the personal history paragraph right after the introduction. Guys, as you know, this is not an emergency letter, so this is non-emergency letter. So after the introductory paragraph, you have to mention the social or the family or the personal history here. So we will write social history here. Mr. Clark is married and lives with her family. So you can exclude this information if your word count is exceeding 220 words. But as our word count was not exceeding 190 words, so I have included this information as well. She has been a heavy smoker for more than 30 years. Please note she has a strong family history of laryngeal carcinoma related to her mother, and her father died of occupational lung disease. So guys, keep in mind some people were committing mistake here that her father or her mother died of. Use proper prepositions, proper punctuation marks, and proper articles if you want to score very good marks in your letter. Okay guys, we have done with introductory paragraph, and we have done with social history, past medical history, and family history paragraph as well. So let's move forward. So we can see here that we have done up till here now. So now we will start with the body of letter, and we will write, we will mention, we will put our visits, we will put the visits of the patient in these paragraph. So very first visit was on the 4th 7/15, and what are the presenting complaints of the patient? Sore throat, body aches, and the fever and the cough, and he was prescribed augmentin. So let's move and see. Initially on, we will mention initially with first visit with date. We will write like initially on, Mrs. Clark presented with the complaints of sore throat, body aches, and fever along with cough. As a result, augmentin was prescribed. Okay, so in this way we will mention our visit. Keep in mind that while you are mentioning any visit, first of all mention the presenting complaint, first of all mention the complaint in this visit. Then if there is any examination findings or laboratory test, and then mention those. But in this visit only the complaints of patient and treatment was given, so we have just mentioned the complaint and then augmentin was prescribed. Okay, then let's read the case note of the next visit. Okay guys, so on the next visit, which was on the 22nd of August 15, presenting complaint was 7-week history of the dry cough, non-productive cough associated with mild shortness of breath and strained sensation in the chest. Exercise tolerance test was okay. Okay, let's see how we have written. On today's visit, okay, so on today's visit, Mrs. Clark came with a 7-week history of. So always use article a with history. Presented with a 7-week history of non-productive cough associated with nocturnal dyspnea. So there in the case note was mentioned that difficulty in breathing at night. So as we are referring the patient to a doctor, so we can simply use this medical term, that is nocturnal dyspnea, and a strange sensation of heaviness in the chest. Many people were committing a mistake as well here, that use article the with body parts. Many people were not using this article. If you want to score good marks or you want to score good grade in your letter, in your writing, please use the article very correctively. Okay, heaviness in the chest. Then we will mention that however her exercise tolerance test was satisfactory, it was normal. Now we are starting with examination findings. So we haven't read these findings from the case notes. Let's read them. So examination, these were the normal findings, so we will exclude them and we will include only the findings which we have already underlined. Respiratory examination, signs of the consolidation associated with the monophonic wheeze in the right mid-zone. These were all the systemic normal findings, and no cervical lymphadenopathy, sputum cytology were normal. And on investigation, chest x-ray and CT scan, right middle lobe atelectasis and enlarged right hilum. So let me tell you now that how we will write these information in the letter. So her systemic and the respiratory examination were unremarkable. All the systemic examination, temperature, body weight, and everything was normal. Lymph node status, apart from, so we can simply mention like this: her systemic and the respiratory examination were unremarkable apart from the sign of consolidation associated with monophonic wheeze in right mid zone. Or we can write like this as well, that on respiratory examination the signs of consolidation along with the monophonic wheeze in the right mid zone were noticed. Additionally, an X-ray and a CT scan of her chest revealed right middle lobe atelectasis with an enlarged right hilum. So guys, So this paragraph, this visit is very complete description of that how we will put presenting complaint, examination findings, laboratory investigation findings, and plan. So here presenting complaints are given, here examination findings are given, here laboratory test which include X-ray and CT scan findings are given. So keep in mind, some people were also doing mistakes here, that they were not using articles with X-ray and a CT scan. Always use an article with X-ray and a with CT scan. So that's why I have mentioned that an X-ray and a CT scan of her chest revealed right middle lobe atelectasis with an enlarged right hilum. Okay, so these signs are suggestive of bronchogenic carcinoma. You can mention here as well, but I haven't mentioned this that they are suggestive of bronchogenic carcinoma, because we have already mentioned the diagnosis in introductory paragraph. So after mentioning the presenting complaint, examination findings, and the laboratory test findings, so what is our plan? So we will write the plan with as a result, consequently, or therefore, but avoid use of therefore, use as a result, or consequently. So I have mentioned consequently she was consulted on the probable diagnosis and requirement of further investigations. Okay guys. So guys, up till now we have mentioned the both visits very well with everything which we have to include. We have included all the information. So in the next paragraph we will write our plan, that why we are going to refer the patient. So here we can write that in view of the above, we can write that I am referring this patient. But guys, please don't use this word again and again, that I am referring, as we have already mentioned in the introductory paragraph that I am writing to refer. So we have used refer word once, so it's okay. So don't use that I am referring, but it's look good, it's look very good if we use it. Would be greatly appreciated if you could arrange further investigation. So here we are being grateful to the doctor you're referring the patient, so it would be greatly appreciated if you could arrange. And we are mentioning our plan, and we are going to mention what you have to do. Okay, if you could arrange further investigations including bronchoscopy with a biopsy and manage Mrs. Clark condition accordingly. So mention the plan in introductory paragraph and in the conclusive paragraph as well, but with different words. So in introductory paragraph we were using it would be I would be grateful if you could assess and investigate her, but here we are using that arrange further investigation including bronchoscopy with biopsy and manage Mr. Clark's condition accordingly. So okay guys, so it looks more good as compared to some other templates, so please use this type of template while writing your letter. So then leave a space and mention should there be any queries. Always apply a comma after should there be any queries, please do not hesitate to contact me. You can also cram this line as well, because this also include from the template as well. Then leave a space and mention yours sincerely. So guys, keep in mind some people are using a capital S here and some people are missing S here. So always use S here and use a small s here. Yours sincerely, comma, then leave a space, doctor. Always put a full stop after this, doctor. So guys, this was all from today's video and from last case notes. So inshallah in future we will be uploading the videos after every case note, so you can improve your writing from the case notes of your letter. So guys, please keep in touch and please follow these guidelines so you can easily pass your OET exam of your writing. Okay, inshallah these videos will definitely help you in correcting, in improving your writing skills. So guys, thank you very much for watching, and remember me in your prayers. Bye bye. Allah Hafiz.